In my department, it's very cold. It's blood and fat everywhere on the floor, and it's kind of messy sometimes. We see a lot of blood in the beginning. I don't like it.
That's Sandra Silbert talking about pre-pandemic life working at Smithfield's meat processing plant in South Dakota. Once COVID-19 hit last spring, Sandra said she had to make her own masks, praying every day she wouldn't get sick. That was nearly a year ago. How safe do you feel going into work now?
It's not real safe. It's not social distance in this area. We don't have enough water for wash our hands. We don't have enough bathrooms. If it's the way they're treating people, it's not right.
The Smithfield plant was home to one of the first major outbreaks last spring.
This plant is incredibly important to our food supply in this country.
A Columbia University study found that early in the pandemic, as many as 1 in 12 COVID cases could be linked back to meatpacking plants. Across the country, the plants required to stay open by executive order to ensure America's food supply.
It was a bottleneck caused by this whole pandemic.
But a year later, these essential workers don't have clear guidance on when they'll get the vaccine.
It's been very rough for these workers. They've been through a lot.
In a statement, Smithfield said, quote, "We have taken extraordinary measures at our facilities to protect the health and safety of our employees, including pre-screening and on-site testing, barriers, masks, and shields, and enhanced air purification systems," adding that they've seen low relative case levels for months and that they've been communicating with employees about vaccine availability. Some locations like JBS in Colorado and Tyson in Iowa and Arkansas have held mass vaccination days for workers. Here in South Dakota, though, workers may not see a vaccine until April.
The people working in that industry in our state that keeps our state going are immigrants and refugees. And to not prioritize them, is troublesome. It signals a lot of the things that we're advocating against, whether it's a misunderstanding or whether it's actual bigotry.
They don't care they don't care in the beginning of the pandemic, and they don't care right now. Because if we're a priority, they give us the vaccine. But when people ignore us like that, we feel alone.
The CDC advised that food processing workers get access to the vaccine before people older than 65 or younger people with underlying conditions. But nearly every state ignored that guidance. Now, just 12 states include meatpacking and food processing workers in their vaccine access allocation. In Colorado, 3,000 workers were paid to take the day off to get the vaccine after a push from the union to get the state and National Guard to allocate doses. Do you think it needs to be such a push in order to prioritize worker safety?
We need systemic change, and these are things that our elected officials can help workers, get. In all of this, had we had this, some of this cooperation in place last year, I believe we would not have seen, 500,000 deaths in this country.
Back in South Dakota, workers are in Phase 1E. After teachers and funeral service workers. What keeps you here? Why still come to work at a place where you and your coworkers don't feel safe?
Because we need to feed our families. We have a family at home. We have kids. We have to feed it. And we have to stand up for the country. The country gives you too many things to us. They open the door for us. It's only one way to give you back to the country. Stand up.
Maura joins me live now. Maura, the numbers are just crazy. Nearly 22,000 meatpacking workers have been infected with or exposed to COVID-19. 132 have died, according to the United Food and Commercial Workers International Union. If these workers are essential, why aren't they a priority in all states?
Right, that's the million-dollar question, Allison, and I put that question towards the South Dakota Department of Health, and they kind of skirted around the answer, responding to me saying that they look forward to vaccinating essential food service workers in our next priority group. Given South Dakota's record progress on vaccination efforts, provided an increase in vaccine allocation from the federal government, such should start in the near future. So not an answer on how exactly they came about the reasoning and how they allocated vaccines and how the phases worked out. And what's interesting interesting is that from the beginning of the pandemic, it was companies like Smithfield, JBS, Cargill plants across the country that weren't having the right safety precautions for those workers, and that's why we saw the outbreaks happen. But now the onus is on the states, because the CDC issued that guidance saying how important it was for these food processing workers to have access, and yet every state is doing it differently. And so that's the problem, is that state by state, there's different guidance, and they can kind of go with whatever they're looking for. But at the end of the day, these workers have not been able to work remotely for the entirety of a year, except for when the plant shut down because of the outbreaks. And when you hear from people like Sandra, who says that they just want to put food on the table for Americans and help keep the country going. Allison.
Maura, I know Iowa did prioritize its food workers, but many of them turned down that shot. Here's what editor Art Cullen of the Storm Lake Times told MSNBC's Steph Rule this morning.
I think it boils down to one word: trust. They don't trust the government. Most of the employees here in Storm Lake are immigrants, primarily from Latin America. The way the state tried to make the workers feel safe was threatening to bar unemployment benefits if they refused to return to a potentially unsafe workplace last April.
Maura, tell us more about the hurdles getting these workers vaccinated.
Well, in addition to the trust issue that Art was discussing, there's obviously also the trust issue in the companies providing vaccines for these workers. A lot of them, like we mentioned, immigrant and refugee workers. Sandra mentioned a lot of her coworkers don't want to get the vaccine because they think it'll make them sick. They don't have trust in the safety that the company is going to be administering them. And the big hiccup there that both Tunisia, who you heard from in the piece before, and Sandra, is that this is an English-only state. In South Dakota, Iowa is a similar situation. And so when they're not getting active communication and education in English, these people who work here don't speak English as their first language. There's a variety of languages present. And so they need nonprofits like Tunisia's group to be translating those materials to get adequate education. Otherwise, all they're getting is misinformation or lack of information, which leads to further vaccine hesitancy. Allison?
All right, Maura Barrett, thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.